We all want great, healthy-looking teeth. Well, I've come to the Ferring Dental Clinic to find out just exactly how they achieve this. Hello.
Hello.
I'm Mark Lipscombe, here to see Dr. Stefan.
Yes, he's expecting you. Please come through.
OK, I'm not going to get a parking ticket outside, am I?
Oh, no, we've got plenty of parking with no restrictions.
Great, thanks very much. Dr. Stefan.
Hello.
Hello, I'm Mark. Nice to meet you.
Nice to meet you. Call me Glenn.
Thank you
Have a
very much.
seat.
Thank you. Glenn, tell us a little about the history of this clinic.
Yeah, that is a family-run surgery. And the idea of it was actually to copy the sister surgery, what we have in East Preston, what is quite successful, and the demand is huge here. So we just thought we start all over again.
So you carried the same plans over into here as well?
And so far it worked quite well.
Now all this equipment around us looks very technical. Tell us a little bit about it.
It's the latest state-of-the-art of equipment. Yeah, it helps not just us working easy on the patient, it is in different ways quite educational as well, like digital x-rays, what you can present to the patient to show things, you don't have to talk too much.
Now Glenn, one of the biggest fears that people have about going to the dentist at any time is pain. How much can modern technology overcome this fear?
It definitely has an impact, Mark, yeah, but it starts all on entering the surgery, if the receptionist has a smile on her face or not. It goes on to the dental nurse and she puts the patient on my chair here. We have a talk at first. The first thing anyway is a checkup, yeah, it's more talking than anything else, and treatment comes after that. If that is all not good enough and you have a very nervous patient, if it comes down, let's say, to injections, things like that, what is normally the case, then we can offer something like the wand, what is a very new gadget we are proud of, yeah. It is computer-controlled anesthesia, and that works quite fine as an alternative to the normal injection.
Now, is the wand the most up-to-date form of anaesthesia that you have?
It's definitely a huge improvement to the old-fashioned way of doing it.
Another concern of people now is the use of mercury fillings. Do you use those here at the clinic?
We don't use mercury or amalgam filling, what it is called as well, at all. Yeah, we have better alternatives in place, for instance, composites or ceramics. Yeah. The idea actually of having the filling in a proper way done is to make it look as natural as possible, yeah, and not to see any silver or grey things in your mouth.
What other services do you provide here at the clinic?
We actually offer all aspects of general dentistry. It starts with a checkup, yeah, definitely fillings, root canal treatment, extraction. We have dentures on offer, or crowns, veneers, bridges, hygienist service, teeth whitening, you name it, we do it.
Why would I need to come and visit the hygienist?
To generalize that is a bit tricky. Yeah? It depends on the personal situation. So what we do first is having a checkup with you. Yeah? We see how is your personal hygiene. Yeah? Unfortunately these days a lot, I would say up to 90–95% of the population do need the hygienist, or let's say benefit from that service.
And probably the biggest question that most people will want to know at the end of the day is, are you expensive?
No, we are not, but I totally understand these worries these days. Yeah, what we do have is a payment scheme, yeah, that enables our patient to pay on a monthly scheme, so monthly fees. There is no surprising bill at the end. So if it comes to, let's say, a new filling has to be done or a tooth needs to be extracted, yeah, it's all covered under this payment scheme.
Glenn, what do you most enjoy about your job, looking into people's mouths?
I love to create something. Yeah, I love to see a smile at the face of the patient if they leave our surgery. And like everybody, I like to have a referral of a happy patient. If a new patient comes to the door and says, I heard from my neighbor, you're a great dentist, I mean, that puts a smile on my face.
Now, of course, as soon as somebody walks in and sits in this chair, they're putting a tremendous amount of trust in you, aren't they?
Definitely, and I don't want to disappoint that.
And do you offer an emergency service?
Yes, we do. I mean, we are open anyway from Monday to Saturday. Yeah, if there is a problem, you give us a ring. We try to book you the same day. We have an emergency phone number outside on the window. If they would call me on a Sunday and it's in any way possible to me, I would come and have a look to the patient.
Well, Glenn, thank you very much for allowing us to visit you today. It's been a great pleasure to meet you. Thank you.
You're very welcome. You're very welcome, Mark.
I came to Ferring Dental Clinic because I had problems with my gums and my teeth, lots of bleeding going on. So I came to see the hygienist here, who was very, very, very good, put me at ease, and the results have just been absolutely fantastic.
I recently received some treatment at the Ferring Dental Clinic, and one of the things that really impressed me was the wand tool which was used. Now, I have had anaesthetics before in the past, and they can be quite intimidating. But like this one was much better because you just weren't even really aware that it was there, and it was totally pain-free. So that was one of the really good things about the treatment I had here.
When I first came to see Glenn, I had a real problem with my teeth, in particular my front teeth, which were discoloured. But I had trouble eating as well because of I had the gaps down here and gap down up here. I had bridge crowns fitted top and bottom here, and all the front teeth were crowned, so that they were all lined up, all straight, where before they were crooked. And they're now, it's giving me a decent smile now, so I'm really pleased about that. You can see the teeth, they're really nice. But I have 2 more to do down here, which I'm waiting to, well, I've got to come in and see them and book them in. But at 68 I really feel great with my teeth now, and it's given me the confidence back in my life.